Hello. Hello. My name is Dr. Rose, and I am a cardiologist. Pleased to meet you. So, your primary care physician had referred you to me today, and it would seem that you are suffering from a bit of fluttering, palpitations, a bit of shortness of breath when you get your heart rate up. Is that correct? Okay. So I just wanted to start off by asking you, how are you doing? How are you doing today? Okay. You're a bit stressed out? Yeah. And okay, you've just gotten over a cold? Okay. All right, and how are you feeling now? Okay. All right. So I'm just going to start off by asking you a number of questions just to get your health history, your medications, lifestyle, all that sort of thing. It's a rather long questionnaire, but I just wanted to take an opportunity to just get to know you a little bit better. And then what we're going to be doing is we're just going to have a look and a listen to your heart a little bit more in depth, and I can educate you a little bit about how the heart works if you like. And yeah, so I'll be using my stethoscope and I'll be having a listen to your heart and your lungs as well. And then I am going to be taking your pulse and your blood pressure in both arms, and I will explain why a little bit later. And then we are going to perform an electrocardiogram, a very non-invasive, short in duration test to measure your cardiac electrical impulses. All right. And finally, we're going to draw a little bit of blood. But don't worry, I've been doing this a long time, and it'll be quick and relatively painless. Okay, so let's start off with the health history. Okay. All right, I'll just get my notes out here. So can I just get you to spell your last and first name for me? Okay. Okay. And your date of birth? Okay. All right. And your occupation, what is it that you do for a living? Okay. All right, and your family members, spouse, children. Okay. All right. Okay, so we're just going to go into some of the health-related questions. So I just wanted to start off by asking you, do you have diabetes by any chance? Okay. All right. And are you insulin dependent? No? Okay. Is it? It's metformin. Okay. And what dose? Okay. All right. And when last did you check your blood glucose or your sugar levels? And what was that reading? Okay. It's a bit high for the first thing in the morning. Okay. Oh, that's a good reading for after a meal and at bedtime. Okay, so fairly well controlled. All right, excellent, excellent. And have you ever been tested for or been told that you have high levels of cholesterol? Okay. All right. And are there any family members that you know of that have high cholesterol? Mm-hmm. All right. Mm-hmm. On your mother's side? Okay. And is there anybody in your family that you know of that has had a heart attack or a transient ischemic attack or a stroke or coronary artery disease? Uh-huh. All right. 5 years ago? Okay. All right. And did they have any kind of surgery to open any blockages in blood vessels? Oh, okay. Yeah, that's a fairly minor procedure, but any surgery is, yeah, can be stressful. Okay. Just make a note of that. Okay, and are you a smoker? Mm-hmm. Okay. And for how long were you a smoker? And how many packs per day would you say? Just an estimate. Okay. Okay. All right. And do you consume any alcohol? And if so, how much alcohol would you say that you consume per week? Uh-huh. Okay. Now, I did receive your email detailing some of your diet, your dietary, what you consume usually in a typical day. And this is very exhaustive. Thank you very much for sending it to me. And so just sort of going over some of your dietary choices. It does look like you do consume, I am seeing that you do consume a lot of foods that are very high in sodium. Right. And sodium, high levels of sodium or abnormal levels of sodium can definitely affect your overall health, and it can affect your heart health. You know, there's an old saying that says, wherever salt goes, water flows. Yeah. So it can definitely contribute to an increased cardiac load, and it can cause your heart to work a little harder. So what I might do is just refer you to, after our appointment today, is refer you for some nutritional counseling. And yeah, I mean, overall though, your diet is very good. You have a lot of fruits and vegetables, a lot of fiber, and appropriate amounts of protein. So I think you're doing quite well there. So we just, I think, have to look at your sodium levels and your glucose levels as well. Okay? So carrying on, the nurse had taken your weight earlier today. Okay. And is this your usual weight, or have you recently gained or lost a significant amount of weight, let's say in a short period of time by any chance? Okay. Okay. And why do you think that was? Okay. Sure. Okay. Okay. And do you exercise at all? Okay, excellent, excellent. Yes, vacuuming the house does count. Okay, yeah. You know what? Every little bit of exercise counts. You know, get those triglyceride levels down. That certainly can help. Yeah. Okay, all right. And so let's get into your prescriptions. Now, you were mentioning the metformin. Okay. And okay, ibuprofen. All right. Okay, Lipitor. And how long have you been on the Lipitor for? Okay, we'll take that into consideration when we do your blood work later today as well. Okay? All right. Any other sort of over-the-counter, okay, yeah. Okay. And how long have you been on that antidepressant, on that SSRI for? Okay. And do you find that it's effective? Okay. Helps you to sleep? That's good. That's excellent. Yeah, that's a commonly prescribed antidepressant for sure. Okay. So any over-the-counter medication, any herbal supplements? Oh, okay, echinacea and oil of oregano. Okay, yeah, people do often take that for cold and flu-related symptoms. Okay. Excellent. And do you drink coffee? Yeah, a lot? Okay. I do too. Yeah. Okay. Okay. That's 6 cups. Okay. And would you say that you're particularly stressed? Okay. Okay, work, restructuring. Okay. Okay. Oh, it's the year end. Oh my goodness, yes. Everybody works harder. Everyone's a little bit more focused to meet that deadline. Yeah, for sure. Okay. Oh, the elevator went out in your build. Oh my goodness, and you had to. Oh, okay, you had to climb up 16 flights of stairs, and that's when you got the palpitations and the sort of the tightness in your chest. Okay, I see. Okay, all right. So that just sort of takes us right into the next section here. So how often do you, other than running up 16 flights of stairs. Do you often feel chest pain or discomfort? And is it always related to exertion? Okay. Okay. And are there any other kinds of activities that bring on this discomfort? So you would describe it as a little bit, okay, uncomfortable pain. Oh, okay. Yeah. And then on a scale of 1 to 10, from 1 being no pain and 10 being the worst pain that you've ever felt, where would you place that particular discomfort? Okay. Okay. And does it radiate down your neck, your back, shoulder, your arms at all? Okay. Okay. And you were already mentioning that you have palpitations and a little bit of fluttering. Yeah. Yeah, it feels like a skipping almost. Yeah. Do you ever feel nauseous, like you're going to throw up? Okay. Well, we're about 2/3 of the way through the questions. I know this is a very detailed questionnaire, but I want to really get a good overall picture of your health. Okay. All right. Are you comfortable? You're still good? Okay. Good. And this is a very important question. Does this discomfort ever wake you up at night? Like, let's say 1 to 2 hours after you go to sleep? Oh, okay. Any sweating? Okay. How about wheezing or coughing? Like, do you have to go and open a window and grab some fresh air? Okay. And what, if anything, do you do to sort of make you feel better? Okay. Generally, we call this uncomfortable awareness. You're aware that you're uncomfortable with your breathing, and generally, which is inappropriate given your level of exertion. We call that dyspnea. Okay. Okay, and this next question is also very, very important. We have what is called orthopnea, and that is where you experience discomfort when you're lying down, and then when you get up, it's usually relieved. So my question is, do you need to sleep, let's say, with a set of pillows with your head elevated? Okay, all right. Okay. Now, have you ever noticed any excessive swelling, let's say, in your extremities, so your fingers, your arms, your feet, your legs, for example? Have you noticed, I noticed that you're wearing a couple of rings. Yeah, do you ever notice that they get tighter? Yeah, kind of, puffiness in your fingers is more pronounced on one side of the body than others. Do your feet or shoes ever feel tighter? I know I'm throwing a lot of questions at you in one swing here. All right. And is the swelling usually worse or better in the morning, during the day? night. Okay. Okay. Okay, yeah. Well, we call this edema, which is a fancy word for when there's too much fluid in the interstitial spaces. Yeah, in between your cells, yeah. Okay, yeah, I notice a little bit of swelling. I'm just gonna, actually, if you don't mind, I'm just gonna take a look at that. Okay, okay. Okay, that's actually not too bad, but you say it is worse in the evening. Yeah, when you've been on your feet. Okay. Okay. Okay, so that's the end of the questions. Thank you for sticking with me. Thank you for your patience. Okay, so first of all, I'm going to, and I see you do have your hospital gown on. Thank you for doing that. We're going to need to take a little bit more of a detailed look at the anterior or the front part of your chest. Yeah, okay, so I'm just going to have a look. Put my clipboard down here. Okay, so what I'm going to do is I'm just going to palpate, which means I'm just going to sort of press on different areas of your chest. And sometimes we can feel the heartbeat. We can feel any irregularities in the heartbeat. We can feel for any turbulence of blood flow. So, yeah. Yeah, so, okay, so just just sit up straight and just breathe normally. And okay. Your pulse rate is a little bit, rather your heart beat is quite strong. And okay, and on the other side. Yeah, what I'm doing right now is I'm just feeling for what we call the point of maximal impulse, which is the fourth or fifth intercostal space. So I'm just going to trace right from your from your collarbone, and I'm going to feel in between each rib. That's the intercostal space, is the fancy word that we use for the spaces in between your ribs. And I'm going to go down to what we call the base of your heart, or the apex, sorry. Your heart's kind of shaped like this, and we call this the base, and we call this the apex. Okay, so I'm just going to feel for that. All right, so okay. Okay. Now, I'm just going to make a few notes. Okay, now what I want you to do is to sit straight and lean forward and exhale completely and hold your breath just for, upon expiration, just for a bit. Okay, so 1, 2, 3, lean forward. Exhale. Okay. Okay, excellent. I do this because it can, I am checking for any aortic, aorta is sort of the top portion of your heart, right where the blood goes out into, and then further from that goes into all your arteries. Right. And it feels pretty good. Okay. And next, I'm just going to have a listen to your heart. Now, yeah, the heart actually has 4 chambers. Okay, it has 2 atria, which means the top 2 chambers, and the bottom 2 chambers. And and the blood, in what we call sort of the cardiac cycle, the blood flows from from the ventricle. Let's say we can start at any point through a valve into the atria, and then it can go into the aorta. And when the blood passes from one chamber into the next, those valves close, and it produces a lub or a dub. Yeah, the lub-dub that you hear. And sometimes those valves don't work correctly. They either don't close all the way, or and you get regurgitation of blood in the wrong direction. So I'm going to actually use my stethoscope, and I can actually hear if there's any turbulence in the way that the blood is flowing from one chamber of the heart to the next. And there's sort of 5 major spots that I'm going to be listening to in your heart. This will give me a little bit more of a detailed picture. All right. I'm just going to check in. How are you doing? Are you feeling any pain or discomfort right now? Okay, is it warm enough in here? Good. Yeah, I know. I probably should have asked that at the beginning, but anyway. So I am going to I'm going to just take a listen. So just breathe normally. Okay? Yeah. Okay. Yeah, in and out. Okay. Yeah, we have a little bit of an extra hard sound. And what that means is, when you have lub-dub, you could have da-lub-dub or lub-de-dub. Right, and you have just a tiny little bit of an extra hard sound, sort of in the aortic area. Right. Okay. Yeah, it's not incredibly noticeable, and I'm okay. And we'll probably need to do a little bit of further testing in order to sort of determine what might be the exact cause of that sound. Like, for example, an EKG, or an ECG rather, an electrocardiogram, and later at a different date we may do an echocardiogram on you, which is kind of like a moving picture of sort of a little bit of a movie, if you will, of the blood actually flowing from atria to ventricle, ventricle to atria, through the valves, and from the major vessels into major vessels. Right. And I think that swelling too in your extremities is also important, because your heart is needing to work a little bit harder when your fingers or your feet are swollen for whatever reason, which we'll determine at a later date. But today is all about assessment. So it could be that your heart is pushing against some resistance. either from more interstitial fluid or right, any atherosclerosis, any narrowing or hardening of arteries. We don't know that yet, but okay. All right, I just went off on a tangent there. My apologies, but okay. Now I am actually going to just take your your pulse as well. Okay, so I'll get this hand, and I'm going to do the radial pulse, and I'm going to do the brachial pulse, and I'm just going to ascertain which, I'm going to ascertain the character of the pulse, the strength. Yeah, the strength of your pulse, sure. Yeah, and how many beats per minute for, okay. All right. So I'm just gonna put my fingers on your wrist there. Okay, okay. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Okay. And then I'm going to do that the same thing on your radius on the other arm. Okay? 3, 4, 5, 6, 7, 8, 9, 10, 11, 13, 14, 15. Okay, so your pulse rates on both arms, and we do both arms because we want to compare. Let's say, for example, if you have swelling in one extremity and not the other, you have some kind of resistance against which your heart is pushing, against which the flow of blood is pushing. That's going to reflect in the quality of your pulse. But both radial pulses seem to be fairly equal. We've got a pulse of about 75. Yeah, we got 73 in one, 75 in the other. Okay. Yeah, sometimes the pulse itself can be different in your extremities than in your actual heart, because blood is traveling from your heart to your extremity. Yeah. And things can happen to it in that journey. Okay. Now I'm just going to take your brachial pulses as well. Here and here. All right, here we go. And then on the other side. Okay. Okay. All right. Okay. And so carrying on, I'm going to now take your blood pressure in both arms. Okay. And we have two numbers involved in a blood pressure measurement. Right, the top number is the systolic and the bottom number is the diastolic. Okay, and it's measured in what we call, it's a measurement of pressure that we call millimeters of mercury. All right, and the top number measures the pressure when the blood is ejected from the left ventricle into the aorta. Okay, and diastole, which is the bottom number, is when your valve going to your aorta closes and the mitral valve opens and the blood flows from the left atrium into the ventricle. Okay, now top number is generally higher. It should be higher, much higher than the bottom number, because the top number represents when that blood is when the heart is contracting and squeezing the blood. Right. Yeah. Okay. So the reason why we do blood pressure in both arms, let's say your blood pressure was 120/80, which is sort of the gold standard. It's different for everybody. Your normal blood pressure might be 130/85, for example. So not everybody has or should have a blood pressure of 120/80. But we do see blood pressure in both arms because a difference of 10 pressure points or millimeters of mercury points between each arm can sort of indicate an asymptomatic peripheral vascular disorder or other cardiac disorder. So I kind of like to be very thorough and very precise. Okay, so I thought I would just explain that before I start. Okay. So I'll just get you to extend your arm on this side. Right. Yeah, just keep it right at heart level. Yeah, that's good. That's good. Okay. We've got 130/85 on that side. And we'll go. Okay. And then we'll go on this side. How you doing? Okay. And then on that side we have about 130/90. So we got your diastolic pressure is a little bit higher on the other side. Okay. Oh, okay. So you just had coffee about an hour ago. Okay. No, that's okay. That's okay. Okay, so I'm just going to record my findings here. Yeah, the reason why I asked some of the questions that I asked at the beginning, because blood pressure can fluctuate greatly over a 24-hour period, especially if you have increased physical activity, if you're having pain, great fluctuation in environmental temperature, right, of course, stress, coffee, drugs, tobacco, and something as simple as the time of day. Yeah. Some people monitor their blood pressure constantly, and I actually don't suggest that you do that. Yeah. And if you do monitor your blood pressure, however, it usually at the same time of day is is usually good. Yeah, I don't see any reason for you to be self-monitoring. Yeah, I find it can actually produce more stress than it's worth. Yeah, I mean, that's like weighing yourself 6 times a day. You get stressed out by the numbers, and then all of a sudden you're just thinking about the numbers. And if you're stressed out, it can actually artificially or just rather very temporarily increase your blood pressure. Right. Yeah. So we'll just keep the blood pressure measurements in a clinical setting. Okay. All right. You still doing okay? Yeah, I know that blood pressure cuff is a little bit uncomfortable. But... All right. So, so the next test that we're going to be doing is an ECG, or an electrocardiogram. And with each contraction of the heart, your smooth muscle produces electrical activity, resulting in a series of waves. We call that a PQRST wave, either on a piece of paper or on a telemetry monitor. Today we're actually just, as you can see, I've got the piece of paper there, and what we're going to be doing is attaching the cardiac leads to 5 different points on your chest. Yeah, it's non-invasive, it's not painful. The cardiac leads have a little bit of gel, built right into the, and that's a conductive gel, and so it facilitates conduction between the skin and the electrodes. Right. Okay. Well, actually, it records the heart's activity on and the strip of paper actually moves, and we can tell whether one side of the heart is enlarged, for example, whether you've had an MI or myocardial infarction in the past, or heart attack, or we can tell if there's cholesterol clogging up the blood supply to the heart. So there's a number of different things that reading and interpreting the conductive activity, or the electrical activity of the heart, there's a number of things that can tell us. Okay? All right, excellent. So I'm gonna put some gloves on. So there's 5 stickers, and then I'm going to attach a wire to each sticker, and then each wire will feed into that machine over there. And it won't take us very long at all to get a reading. Okay? All right. So stick this one here. All right. Now look at the second one. Right. I'll just stick it on there. There we go. Get this wire put in here. Okay, excellent. And we'll get the third one. Okay. Okay, and let's see. And the fifth one. do is we'll just turn on the monitor. Just relax. And we'll turn on the monitor. Okay. We'll just wait for a little bit. Okay. Okay. And I'll just take this one off. Take that one off. That one off. And the middle one. Okay. Yeah, and then we'll just dispose. Yeah, we don't use the same leads or the same stickers on everyone. Yeah, the conductive gel is just made up of sodium or salt and water. It's a bit sticky, but sure, yeah, it will just come off with soap and water, but I can actually clean them off for you right now. Okay. Yeah, I'll just dip this and some water. Okay, there we go. Yeah, the gel just comes right off. Excellent. All right, so you're all good. Okay. So we're almost done. The one thing that we have left to do is blood work. And this is very, very important. What we're going to do is we're going to take a fairly large amount of blood today. And don't worry, I'll make it quick. And what we're going to do is we're going to do a cholesterol or lipid panel, which helps to measure the amount of cholesterol that you have in your blood. Also, these measurements can indicate your risk of having a heart attack or other heart-related illness. And so what we're going to do is we're just going to do CBC diff. We're just going to check your, it's common, it's in every test, your electrolytes, your sodium, your calcium, your magnesium, your chloride. And interestingly enough, those we call those electrolytes. And like I was mentioning earlier, the sodium, as well as chloride and other electrolytes, can definitely affect the contractility, the ability of the heart to the conduction that causes the heart to contract. It can greatly affect that. We notice that when people are extremely dehydrated, they have arrhythmias in the heart. Yeah, so that can be caused by an electrolyte balance. So we want to make sure that we know what your electrolytes are, what the levels of the different electrolytes are. We want total cholesterol level. We want HDL, which is a high-density lipoprotein, which is they call that the good cholesterol, which helps take away the bad cholesterol so that your blood can move more freely through the heart and vessels. And then we have the LDL, which is a low-density lipoprotein, and the LDL is also known as the bad cholesterol. Right. And too much LDL can cause plaque or atherosclerosis, hardening of the arteries. And then C-reactive protein, which is a protein that the liver produces in response to any kind of inflammation in the body, right? And that might be related to some of your edema or some of your swelling that you're having in your extremities. Okay, plasma ceramides and the BNP level, which is what your heart, it's secreted by your heart and blood vessels into your bloodstream, and that tries to ease the strain on your heart if your heart is stressed, and those levels, obviously, if there's something remarkable happening, those levels may rise. So if you have increasing pain, unstable angina, or after a heart attack, okay? All right. I'm just going to put my notes aside here. And just going to wash my hands. There we go. Yeah, our hands get so dry. But it's okay. It's very important that our hands are clean all the time. Okay. So is there any particular arm that you would like me to withdraw the blood from? Okay, this arm? Okay. And I always ask this, is there any vein? Do you have blood drawn very often? Okay, here, let me... Okay. Okay, yeah, that does look like a nice juicy vein. Oh, you drank a lot of water today. Thank you so much. Oh, there's nothing like trying to find a vein when the person is dehydrated. Yeah, that was very considerate of you. Okay. So, got gloves here. Okay. How you doing? Yeah, I know this has been probably longer than you're used to in terms of doctor's appointments, but I just want to be thorough. So. Okay. And if you could, yeah, if you could just hold out your arm. I'm gonna just make a fist. I'm gonna tie the tourniquet up around your upper arm. Okay. All right. Okay. Okay. Yeah. Just keep making a fist. Okay. All right. So, take a deep breath. Okay. All right. And okay. Okay, I'm going to release the tourniquet. All right. Okay, we're all done. Okay, just put some pressure. Yep, I've got a Band-Aid. There we go. some pressure on that. Yeah, hold it. Okay. All right. We got a good sample here. Okay, let me see. Oh, it's still bleeding a little bit. I'm just going to take this. Yeah, just hold that on there. Great. And okay, that looks good. Okay, just going to put a Band-Aid on there. Okay. Excellent. Good job. Okay, and we are done for today. You did excellent, and again, thank you for drinking so much water. That helps with the blood drawing process a lot. Okay, so yeah, so moving on from this point, myself and my telemetry technician are going to interpret the electrocardiogram results. Okay. And then what we're going to do is we're going to put the results in a letter. I always like to share the test results and blood test results with my patients. Right, so we're all on the same page. Okay, all right. Yeah. So what I'll do is I will just, I will allow you to get dressed now because you're probably starting to get a little bit cold, okay? Yeah, I know those slippers aren't very fashionable, but yeah, you'll be back in your regular shoes and socks in no time at all. Yeah. All right. And I will also give you that information about the dietary consult that I had mentioned a little bit earlier. Right. Yeah, and then you can just get the program information from the receptionist on the way out. Okay. All right. Well, it's been great to meet you, and you did really, really well today. And you'll probably be hearing from me very soon. Yeah. All right. And if you have any questions for me, please do not hesitate to call, and we will be in touch with your results very, very soon. Okay. All right. You have a great day. Okay. Bye-bye.